When was the last time you visited the hospital without being sick? When was the last time you visited the hospital without being sick? Now, if your answer is that you can't remember, then this message is for you. Come closer. Welcome to Talk Health with Nurse P, where we give you simple health tips that will be useful to you, right? Now, feeling well doesn't mean you're healthy. Feeling well doesn't mean that you're healthy. Now, if you are waiting until you are experiencing some pain or something in your body before you visit the hospital, then you might be blind to certain things that are happening in your body, right? Most times we wait until we are hot before we go to the hospital. Sometimes we wait until when we feel weak before we visit the hospital. Sometimes we wait until when our body starts sending us serious signs or warning. That's when we go to the hospital, right? But here's the truth about this. Not every illness shows symptoms. Not every illness shows symptoms. Conditions like blood pressure, diabetes, and even some infections, right? We've talked about this before. Some infections do not show symptoms, right? They do not show symptoms. Some of these sicknesses or illnesses do not show symptoms. Now, for example, high blood pressure, diabetes, and some infections, they do not show symptoms. They can be there silently but slowly damaging your body without you knowing. That's where regular checkups comes in. Now, think of this. Yes, think of this. You have a car or a generator or some electrical appliances, right, that you know would always require regular servicing. Now, if you do not service your car, you end up having a knocked engine, right? Or you wait until when the engine is knocked before you go to service it. At the end of the day, what you would have is that you end up having a car that may stop you on the road, right? Hang you on the road, spoil on the road, and then you become stranded, right? Think of it like servicing your car or your generator. You don't need to wait for the engine to knock before you check it, right? Your body deserves even more care. Sometimes we have or hear news, we've heard news of people slumming maybe while at work, while walking on the road, while in their homes. And you hear things like, the person was okay, was not sick, or he was feeling well, but before you know it, the person slumps and dies. That's because the body has been giving you signs, has been giving you warning, or this sickness has just been there quietly in the body, but carrying out the damages, right? Now, why does regular checkup matter? Regular checkup helps you to detect problem early. That's number one. Number two is that it helps to prevent complication. Number three is that it saves you money on the long run, because some illnesses, when they are in the body for a very long time, the treatment plan becomes very expensive, right? And they also help to save your life. When you check yourself on time, it helps you to save your life, right? Because there are infections that are there are sicknesses like high blood pressure can kill. But when you check and notice it on time, you're able to manage it and you're able to live healthy, right? Now, what are the things you should check when you go for regular checkup? What are the parts of your health that you need to check regularly? Number one, importantly, is your blood pressure. Number two is your weight. You need to check your weight regularly. And what we also call body mass index. This is what will help you to know if you are obese or not, or if you are underweight, like you're smaller than you're supposed to be. Number three is your blood sugar. This is what will help you to know if you're diabetic or not, right? Now, number four is sexually transmitted infection screening. You go for your STI screening right? This one will help you to know if you have an infection, what type of infection is it? Is it a communicable infection or not, right? Another thing is your general physical examination. That's from your head to your toe. You can run a check. Your hair, what does it look like? Your eyes, are they normal? Are they rightly aligned? Your lips, your ears, are you hearing well? Everything, are there any growth, abnormal growth in a certain part of your body? It is through physical examination that this will be noted. And most importantly, for the females, for the women, breast examination. It is very, very important. And your cervical screening. These two would help you to know if there is a possibility of you having breast cancer or cervical cancer in the near future. This will also help you to protect yourself against it, right? Now, you might feel fine, but feeling fine is not the same as being healthy. Feeling fine is not the same as being healthy. So today, don't wait for your body to cry out. Don't wait for your body to cry out. Be proactive, be intentional. Book an appointment today, visit the clinic, take charge of your health, because your health is not something you wait or fix when it is broken. Your health is not something you fix when it is broken, but something you can protect every day. So if you found this post helpful, follow our page, follow our YouTube channel, Talk Health with Nurse P. Turn on the notification button, like our post, drop a comment. You can also follow me on Facebook at Patience Samuel. There you would see our YouTube handle and you can follow us, right? Drop a like, drop a comment, ask your questions where necessary, right? Thank you so much, and we're glad to see you in our next video.